only mode.
Hello and welcome to the February Loveless Healthy Steps webinar. Today's topic, exercise for a healthy heart. My name is Angela Gonzalez and I'm a wellness consultant for Loveless Health Plan. My background is in wellness programming and I hold a master's in exercise physiology. Today's topic will focus on specific information about heart disease and how exercise can help as a treatment. Before we get started, let's review a couple of important things. The presentation will last about 20 minutes. Everyone will be in the lesson only mode. If you have any questions about anything, please feel free to email us at healthysteps@loveless.com. You can expect to hear back from us within 48 hours. We won't be taking questions during the presentation, so if a question comes to mind, jot it down and email it to us. We want your feedback about the presentation and to know how we can support you in the future. So please complete the evaluation that you're going to receive after the presentation via email. Sometimes during the presentation, you're going to notice there's a delay in the slides or audio may become scratchy. If for some reason you get disconnected, simply call back in. So let's go over today's agenda and what we're going to be talking about. We'll be talking about the heart, why it's your most important muscle. We'll be talking about what is heart disease, some of the risk factors to look out for, exercise as a treatment, how to get started with exercising, some precautions to take, the types of exercise that work best, some examples of aerobic exercises, how often to exercise, what to include in your program, and then we'll sort of go over a summary of everything that we learned today. And at the end, I will provide you with some resources that we provide for all our members and some prevention reminders. So let's get started. Why is the heart your most important muscle? To answer this question, let's first review how the heart works so that we can better understand heart disease. The heart is like any other muscle. It requires blood to supply oxygen and nutrients for its function. It beats about 100,000 times a day, pumping blood through your circulatory system. The cycle of pumping blood throughout your body carries fresh oxygen to your lungs and nutrients to your body's tissues. Blood also takes waste, such as carbon dioxide, away from your tissues. Without this process, we could not live. So if you really think about this whole process, our bodies are really amazing, aren't they? Each organ, each cell has its purpose. So please, don't take your body for granted. We want to make sure that, it's the only body we have in this life, so we need to take care of it. And what is heart disease? Well, heart disease begins when cholesterol or fatty materials or substances and calcium build up in the arteries. When this occurs in the arteries that supply the heart, this buildup or plaque causes the arteries to narrow so that oxygen delivery to the heart is reduced. The reduction in oxygen delivery to the heart can create chest pain, also called angina. And the link between heart disease and heart attack, well, when plaque builds up to the point that it ruptures, it causes a blood clot to form in the coronary artery. The blood clot blocks blood from flowing to the heart muscle, leading to a heart attack. In a worst-case scenario, sudden cardiac arrest or fatal rhythm disturbance can occur. And remember, heart disease is the #1 killer. Yes, it is. Many times we think auto accidents, we think epidemics, we think the flu, things are going to kill us, but actually it's heart disease that's going to kill us. It's the #1. Heart disease is a permanent condition. There is no cure. As of 2004, the American Heart Association estimated that more than 79 million people in the United States are living with some form of cardiovascular disease. It is the #1 killer of Americans, both men and women. In fact, heart disease is the leading cause of disability in American women. So let's review some of the risk factors. And you can see from the pictures here, they actually tell the whole story. You see the man lying on the couch. So yes, being sedentary, being inactive, being a couch potato is a risk factor. You'll see the cheeseburger and fries, and yes, diet high in fat, processed foods, foods high in sodium, foods high in or not having enough nutrients is going to be a high risk factor. Also, emotional stress. And although we know that stress is a part of life, we do need to find ways to manage it or even acquire those skills that help us to better cope with the different stressors in our lives. Once we can identify those stressors, then we can work towards a solution or some way to manage it. And then you'll see the last picture of someone having a type A personality, someone that's aggressive, impatient, competitive, that just, is just on their last rope at any time. This is also not good for the heart, and probably not good for other people either. Okay, some other risk factors that I want to mention because they're important is smoking, high blood pressure, high cholesterol, diabetes. And diabetes, keep in mind that it often accompanies heart disease if you have diabetes, because you got to make sure that you get the recommended annual screenings for diabetes, the hemoglobin A1C, your eye exam for retinopathy, microalbumin test for kidney infection, and as mentioned before, your cholesterol screenings and even checking your blood pressure on a regular basis are very important. And then, of course, family history of heart disease is going to play a major role in being a disease factor. Peripheral artery disease, and last but not least, obesity puts you at risk. Okay, so there is no single treatment method for heart disease. Each person experiences heart disease differently, and no one treatment method works for everyone. A multifaceted approach of dietary changes, lifestyle changes, exercise, and medications may be combined depending on the patient's individual situation and needs. But today what we're going to focus on is exercise as a treatment. Getting regular exercise is very important to your heart health, whether you are currently healthy or already have a heart condition. Research shows that people who engage in regular exercise as part of the rehabilitation following a heart attack have improved survival rates compared to individuals who do not exercise during the rehabilitation. And you may know someone now that has had a heart attack recently. The first thing that they'll do is they'll get those people up to start walking and start doing something. A lot of older people are usually resistant to that, but it's very important to their recovery. How exactly does exercise help? Well, physical activity delivers oxygen and nutrients to your tissues. In fact, regular physical activity helps your entire cardiovascular system, the circulation of blood through your heart and blood vessels. It makes it work more efficiently. When your heart and lungs work more efficiently, you're going to have more energy to do the things you enjoy. And as listed on the slide before, there are so many other benefits. There are many precautions that you need to keep in mind when developing an exercise program. So, it's not deciding to exercise is one thing, but really before you begin an exercise program, make sure you call your doctor and make sure everything's okay. And do not exercise if you are not feeling well or if you have a fever. You should wait a few days after all symptoms disappear before restarting the exercise program, unless your doctor gives other directions. If you experience shortness of breath or increased fatigue during any activity, slow down or stop the activity completely. Elevate your feet when resting. If you continue to have shortness of breath, call your doctor. The doctor may make changes in medications, diet, or fluid restrictions. Stop the activity if you develop a rapid or regular heartbeat or have heart palpitations. Also, check your pulse after you have rested for 15 minutes. If it's still above 120 beats per minute, call the doctor for further instructions. And if you experience any type of pain, whether it's in your neck, your arm, your jaw, or shoulders, or if you have experienced any chest pain. Do not allow the activity to continue. Stop what you're doing. Performing any activity while in pain may cause stress or damage to the joints. And of course, any of the symptoms that are listed in this slide may also indicate that you are having a heart attack. So how do we get started? Keep in mind that medications for heart disease and or high blood pressure, which include beta blockers, alpha blockers, calcium channel diuretic medications, may affect your heart rate. With this in mind, heart rate and blood pressure will not be the best indicator of how hard you are working. It is a good idea to use the Borg scale to rate your perceived exertion or how hard you're working. So what is the rated perceived exertion scale? The rated perceived exertion scale is used to measure the intensity of your exercise. This scale runs from 0 to 10. The numbers on the scale relate to phrases used to rate how easy or how difficult you find an activity. For example, if you're rated a 0, meaning nothing at all, that would be how you feel when sitting in a chair. A 10, which it would be rated very, very heavy, would be how you feel at the end of an exercise stress test or after a very difficult activity. In most cases, you should exercise at a level that feels 3, which is moderate, to 4, somewhat heavy. When using this rating scale, remember to include feelings of shortness of breath as well as how tired you feel in your legs and overall. And last but most importantly, check with your doctor before starting any exercise program. Your doctor can help you find a program that matches your level of fitness and physical condition. Some of the questions you might want to ask your doctor are, how much exercise can you do each day? What are your limitations? How often can you exercise each week? What type of exercise you should do? What type of activities should you avoid? And should you take your medications at a certain time around your exercise schedule, before or after? And do you have to take your pulse while exercising? So exercise can be divided into 3 basic types. Stretching, or the slow lengthening of the muscles. Stretching the arms and legs before and after exercising helps prepare the muscles for activity and helps prevent injury and muscle strain. Regular stretching also increases your range of motion and flexibility, helps you relax, helps you decrease stress levels, helps you feel better all over. Cardiovascular aerobic is defined as steady physical activity using large muscle groups. This type of exercise strengthens the heart and lungs and improves the body's ability to use oxygen. Aerobic exercise has the most benefit for your heart. Over time, and as fitness levels improve, aerobic exercise can help decrease your heart rate and blood pressure and improve breathing, since your heart won't have to work as hard during exercise as your fitness levels improve. Strengthening exercises are repeated muscle contractions. It's a tightening until the muscle becomes tired. For people with heart failure, many strengthening exercises are not recommended. Be sure to check with your doctor on which of these exercises you should not be doing, okay? So in general, to achieve maximum benefits, you should gradually work up to an aerobic session lasting 20 to 30 minutes, at least 3 to 4 times a week. And what they're finding out now is that, if you really want to build up to it and you really are a busy individual, even 3 10-minute bouts of exercise a day, leads to some physical gains. So however you want to do it, whatever works into your schedule, that's what you want to do. So exercising every other day will help you start a regular aerobic exercise schedule. The American Heart Association recommends working up to exercise on most days of the week. While the more exercise you can do, the better, any amount of exercise is beneficial to your health. Just keep in mind that for heart health, you'll have to push yourself a little bit harder, staying within your target heart rate or staying between 3 or 4 on the Borg scale. And 3 or 4, remember, is a moderate to hard. And every exercise session should include a warm-up, a conditioning phase, and a cool-down. The warm-up helps your body adjust slowly from rest to exercise. A warm-up reduces the stress on your heart and muscles, slowly increases your breathing, circulation, and body temperature. It also helps improve flexibility and reduce muscle soreness. The best warm-up includes stretching, range of motion activities, and the beginning of the activity at a low intensity level. The warm-up should be at least 5 minutes. So for example, if you're planning on walking maybe 30 minutes on the treadmill, you want to do a warm-up for 5 minutes at a very low speed. And then after you're warmed up, then you can increase the speed. Conditioning, this follows the warm-up. During the conditioning phase, the benefits of exercise are gained and calories are burned. Be sure to monitor the intensity of the activity by checking your heart rate or the rate of perceived exertion scale, and don't overdo it. Exercise at a steady pace. Keep a pace that allows you to still talk during the activity. The cool down, this is the last phase of your exercise session. It allows your body to gradually recover from the conditioning phase. Your heart rate and blood pressure will return to near resting values. Cool down does not mean to sit down. In fact, do not sit, stand still, or lie down right after the exercise. This may cause you to feel dizzy or lightheaded or have heart palpitations. The best cool down is to slowly decrease the intensity of your activity. You may also do some of the same stretching activities you did in the warm-up phase. This phase should be at least 5 to 10 minutes in duration. So again, this would be sort of like the warm-up, slow down on the treadmill, or if you're walking outdoors, slow down the pace for at least 5 minutes. Let that heart rate come down. And last but not least, don't forget to drink water before, during, and after your workout. Keep hydrated. Okay, so let's just summarize everything that we talked about today. Okay, we talked about heart disease and what it's caused by the hardening and thickening of the arteries, often due to high cholesterol. We talked about the heart, how it works, some of the risk factors, and we named some of those risk factors, and some of them included, being sedentary, a high-fat diet, emotional stress, high blood pressure, high cholesterol, obesity. And then we talked about why exercise is an effective treatment and defense against heart disease. And we also talked about precautions to take before starting an exercise program, and the types of exercise and frequency that are more beneficial for heart disease. Loveless wants to make sure that members are knowledgeable about preventive screenings, recommendations for specific chronic illnesses, and general prevention activities. Information on this and the next slide is for both preventing health conditions and managing chronic conditions. Take a moment to read the information on the screen. We encourage you to talk to your doctor about the preventive screenings in the left-hand column, as many of them are not a one-size-fits-all. The tests for chronic conditions listed are part of standard care, but it's always a good idea to discuss these with your doctor as well. We'll stop for a moment just to let you review the slide. This slide continues with more chronic conditions and recommendations if you have these diagnoses. The right-hand column lists other prevention activities we suggest our members participate in to get and stay healthy. Please take a moment to review this slide. If you have questions about any of this information, please feel free to email us at healthysteps@loveless.com. This next slide actually lists some complimentary resources that are offered to all of our Loveless Health Plan members. We offer a telephonic healthy weight program. We offer a smoking cessation program that's also telephonic. We have online tools that we offer for our members and other lifestyle programs. We have a discount program, and remember our monthly webinars. So please be sure to check out our website and take advantage of all these resources. I want to thank all of you for joining us today. If you have any questions about our webinar, please feel free to email us at healthysteps@lovelessness.com. And also remember to complete the evaluation that you'll be receiving via email. We value your feedback, and we use this information to improve our efforts to support you. And remember, check our website regularly and register for upcoming webinars on other health topics. Next month's topic is Protect Your Health and Boost Your Immune System, Lifestyle and Diet. That is on March 23rd from 10 to 10:30. Again, thank you and have a great day.